Thank you for joining us for this webinar, Ear Health and Common Ear Problems for Dogs and Cats. In this webinar, Revival's Director of Veterinary Services, Dr. Marty Greer, will be talking about ear infections, ear mites, allergies, and how they affect the ears, and so much more. Dr. Greer has more than 40 years of experience in veterinary medicine with special interests in reproduction and pediatrics. She received her Doctor of Veterinary Medicine from Iowa State University in 1981, and she's served as Revival's Director of Veterinary Services since 2019. So, welcome, Dr. Marty Greer.
Hi, everybody. Thanks for joining us. Ears are kind of an interesting topic, kind of a fun one. Everybody comes with two. So almost everybody that is out there with a dog, cat, or all of the above are going to have at some point in their life, something happen with the ears. So I want to make sure that we cover a lot of information today. So we're going to talk about ear infections, how frequent they are and why they are, acute versus chronic ear infections, what the ear canal really is composed of, what's the definition of an ear canal, causative factors for ear infections, causatives that cause the problems, predisposing conditions, so things that can set dogs up to have ear infections, the symptoms of ear infections, treatment, prevention, and then complicated ears. So we're going to go through a lot of this material. If you have questions and need anything, please be sure to give us a call. I am happy to return a call to you if we can't answer that with one of our phone staff. So we have plenty of resources to help you. So frequency, ear infections are very, very, very common in dogs and cats, more common in dogs than cats. Part of it is the shape of the ear canal. Part of it is hair in the ear canal. And that shape and hair will cause an accumulation of wax, debris. Sometimes it's foreign bodies. In certain parts of the country, like California, foxtails are very common to have down in the ear canals that creep down in there. There's little plant weed-ons. They get down in the ear canal and they set up an ear infection. They can poke into the eardrum. They can cause lots of havoc. Now, the foxtails can go lots of other places. They can go up the ear, into the nostril, into the lungs, through the skin and the bottom of the feet. They're everywhere. They are just nasty little things to have in your environment if you live in those parts of the world. And then because of those changes that happen, we see yeast and bacteria multiply and then set up an ear infection. So it's really common for you to see ear problems. I want to just mention that ear health is really important because it is such an important aspect. We look in the ear canals as veterinarians with an otoscope, sometimes one hooked up to a TV or some other kind of a monitor. And this ad goes back to 2006. So this was 19 years ago. That's a picture of me in a Hills ad. So at that point, we were doing some studies on the dermatology diet called DD. They had 3 proteins in their diet, 3 different diets that had different proteins, each in them. And I got to be the cover girl for Hills. So there you go. Acute versus chronic ear infections. I think it's, again, important to distinguish those. Acute means something that just started. It's recently developed in the last 3 days. The dog's ear is painful, red, inflamed, angry, draining, smelly, any of those things. That happens just in the, just a couple of days. And that's when you need to start getting this under control, not waiting until this ear infection has been smoldering for weeks and months. Chronic are long-standing problems that don't go away well or that recur. And those become too much of our life for our dogs. So I think it's important that you get on this right away. If you notice anything in the dog's ear going on, and we'll talk about what all those things are, that you immediately jump into action and start doing some things to improve the quality of the dog's ear. So I want you to think about the ears differently than you probably have before. Yes, way down in the bottom of the ear canal is an eardrum. But the ear canal itself is very long. It's L-shaped or J-shaped. It goes down into the dog's ear canal and then across to get to the eardrum, which is the tympanic membrane, the scrolls of bone that help you to understand motion, like if you're moving or not moving, or if you're upside down or whatever. So those are all important pieces of what happened way, way, way down deep in the ear canal. And so if you look in your dog's ear, and you try to look straight in, if you just pick up their ear flap and look straight in, you're not going to see anything. You have to look down the ear canal and then across. If you're looking with an otoscope or just looking with a flashlight, you have to look down. And without an otoscope, you can't get to the across part because it just doesn't work that way. Now, some dogs have upright ears, German Shepherds, Corgis, all those upright eared dogs, Sammies, all that. And then a lot of dogs have flopped ears. So we do see differences in those two kinds of ear shape. The dogs with upright ears, with the exception of German Shepherds, rarely have ear infections. Almost all the infections that we see are in dogs with pendulous ears, or ears that flap down. So I think, again, that's an important factor that you need to take into account when you're monitoring for your dog and they're having ear infections. So basically, the ear is just skin down in a tube. So hair can accumulate. Some dogs grow hair constantly in their ear canal, the schnauzers, the poodles, the doodles. The dogs that have to be groomed on an every 6 to 8 week basis are the dogs that have hair in their ear canals. Breeds that don't, like corgis, like German shepherds, like a lot of other breeds, they don't grow hair in their ear canals. So that's a whole separate category for what we see going on in ears. So the dogs that grow chronic ear hair are going to need additional care over the dogs that don't. And some of those dogs do, most of those dogs do have ears that flop. So this is one of the reasons that people talk about ear cropping as being a medical procedure. It's not generally considered that way, but it can be, because we see so few ear infections in dogs with upright ears. So a Doberman with an upright ear because of a crop isn't going to have an ear infection. A Doberman with a down ear may. So those are all important differences. The ear flap interferes not just with hair, but air movement doesn't happen down in the ear canal because the ear flap is holding it closed. So especially the spaniels, the Cocker Spaniels, the Springer Spaniels, the Cavalier King Charles Spaniels, the dogs with heavy ears, and those dogs do have heavy ears, that flop down, that traps the air. It doesn't allow it to move. It doesn't allow moisture to get out. Wax becomes produced. It doesn't allow it to migrate up the ear canal, and it upsets the entire normal biome of the skin. So bacteria and yeast are normal in small numbers on your entire body, your dog's entire body, down in the ear canal, all over their whole body. You're supposed to have bacteria, you're supposed to have yeast there, but not in large numbers. And it should be a whole mixed bag of different bacteria. What happens is anytime you have a skin problem, allergies specifically, whether it's a food allergy, a pollen or mold allergy, anytime we have those happen, it changes the microbiome in the ear, it changes the environment in the ear, and then one or two specific kind of bacteria will explode in numbers, pushing all the normal bacteria out, all the normal yeast out, and now we have trouble. So everything really sort of cascades and snowballs based on this whole scenario of this is just skin, but it's down in a tube, so it gets you into more trouble. Positive factors are going to include primary, secondary, perpetuating, and predisposing. So primary is inflammation. So anything that causes inflammation in the ear canal. Allergies are really common to see ear problems with. So if the dog has allergies, we're going to see problems. If we see a foreign body, like I said, a piece of plant material, if we see ear mites, if we see a growth, a polyp, a tumor, anything in the ear canal, that's going to set up inflammation. That's a primary ear problem. Secondary requires that the primary problem sets them up for an abnormal ear canal. The yeast and bacteria that should be there start to accumulate, the wax accumulates, and then you become, start to develop this vicious cycle of more yeast, more bacteria, and more because the ear canal is no longer normal. Predisposing factors are things like dogs with really narrow ear canals, and there are some breeds that do, like Shar-Peis. Humidity in the summertime, we can see more ear infections, not just because of allergies, but because of humidity. If the dog swims, or the dog is at the groomer, or you're bathing the dog and water gets down in the ear canal, that changes the environment in the ear canal. So that now becomes a predisposing factor. Irritation. So say you think you're doing the right thing and you go in there and you swab out the ear and you clean it. You have just changed the microbiome. You've maybe ulcerated the skin, and now we have irritation, inflammation, and it becomes a predisposing factor. And then we have perpetuating factors like earwax that just perpetually are there. So those are some kind of different ways to look at this. In the long run, you still have to treat the ears, but I think it just kind of helps you to understand the physiology of what happens in the ear canal and why these things go awry. So there are three basic causes of ear, organisms that cause ear infections, or otitis, which is inflammation of the ear. Bacteria, and typically bacteria in abnormal amounts of certain bacteria. So one or two bacteria take over. It may be Pseudomonas, it may be Proteus, it may be some cocci, but a normal amount of bacteria that's all just a mixed bag suddenly disappears, and one bacteria takes over. It's like weeds taking over your garden. They just grow everywhere. Yeast are the second thing, and we should have a few yeast in the ear canal, but if we see inflammation, then yeast start to grow in increasing numbers in the wax, and then we start to see a yeast infection. And then we have ear mites. Now, ear mites are not common in dogs. They might start off a dog's ear infection, especially if it's a puppy that's been around other animals that have mites, but mites don't live long-term in the dog's ear canal. They will live forever in a cat, but dogs, they're like, ew, I don't really want to be here anymore. And so they tend to move out. So if you're treating your dog for ear mites, you're probably not treating for the right thing. And we're going to talk about that. So bacteria. Under the microscope, bacteria will look like this purple smear. We see white blood cells, which are these round cells. Then we see bacteria, which are tiny little dots. And we'll see pus in the ear canal. We'll see a gray, slimy kind of debris. It can be cocci, it can be Pseudomonas. Pseudomonas has a really particular odor, and it is a bugger to get rid of. So if your vet comes in and says, I want to culture the ear and I think you have Pseudomonas, you're in for a long haul, because those are very difficult to clear up. So having a diagnosis of the specific kind of bacteria can be very helpful to have your veterinarian involved in that. So they need a microscope, they need to stain the slide, they need to do some things, and we'll talk about that. Yeast infections, again, are really common, often associated with allergies, food allergies, and or molds and pollen allergies. So molds and pollens tend to be seasonal. Food allergies tend to be year round, but the dogs will have not only just a brown discharge in their ear canal, but they will also have brown discharge on their feet. Partly they scratch their ear and then they get yeast in their feet, and partly their feet are itchy because of allergies. And because their feet are itchy, they lick their feet, and then it becomes more wet, and then more bacteria, more yeast, more Malassezia will grow, and then they'll get it sometimes on their lips. You'll see brown discharge on their lips, brown discharge in their ears, brown discharge on their feet, and the feet turn red because of constantly licking. So you can yell at your dog all day long and tell them, don't do that, stop licking. And the dog will look at you and then start licking again. And then you tell them to stop again. And then they just go in the other room and they lick in the other room because they know you're going to yell at them, but they can't help it. It's itchy like a mosquito bite is itchy. And doesn't matter how hard you try to convince the dog not to lick at their feet or chew at their feet, they're going to do it anyway because it's just so uncomfortable. There can be an odor associated with this. It can be the smell of bread because it is yeast. So you will start to pick up some of those changes. So if you start to see some of these things, you need to address this with your veterinarian. Now, in this picture, this is what yeast look like. And they're the ones, the dark purple staining little organisms. They look like little bowling pins. So those are the yeast that your veterinarian will look for, your vet tech will look for under the microscope if you're in for an ear infection that they suspect is yeast. So ear mites are kind of interesting little creatures. They are truly a mite. They are microscopic. You can only see them with magnification. And the ear mites will live down in the ear canal, primarily of cats. They will go in the ear canal as a larva. They will grow up into a nymph. They will turn into an adult. They will lay eggs, and then they will perpetuate this life cycle. And as long as you don't address this in the cat's ears, it's going to continue. And it is almost always a problem in cats. Ear mites, I rarely see in dogs. I'll sometimes see them in a young puppy that was just purchased or adopted. I'll look in the ear canal, see some mites. I almost never see this in puppies. It's almost always cats. And cats will have these forever and ever. And even if you get rid of the mites in a cat's ear, they will always have chronic ear problems. So as soon as you get a kitten, if you get a kitten or an adult cat, as soon as you suspect that there's an ear mite issue, you want to get into the veterinary clinic and start treating that. So ear mites in dogs will usually come from a close contact with a cat, like for instance, this. They tend to be short-lived in the dog. They almost never spread to people. That's the good news, is you'll never get ear mites. And that's a good thing, because otherwise I'm around ear mites a lot. I'd probably have them all the time, but they will be long-term in cats. In dogs, they are short-lived, but you will see this discharge. But this is the same color and type of discharge you will see with a yeast infection. So this is where a lot of people believe that they have ear mites in their dog. And in reality, if you looked with magnification, you would not find mites, you would find yeast. So it looks different, it smells different, and microscopically you can tell the difference. So they will scratch at their ears, they will have a brown discharge. Like I said, it will smell like yeast if it's a yeast ear infection, but it can look very much like a yeast infection. And almost always, I'm going to say 99% of the time, if we see this kind of discharge in a dog's ear, it's going to be a yeast infection, not an ear mite. Now, if you do have ear mites, we can go ahead and treat with specific ear mite medications. We carry these at Revival, Aratomite, Mitex. These are the products that specifically will treat ear mites by putting the drops in the ears. It'll suffocate the mites. It'll kill the mites because of the action of the pyrethrin or the ivermectin or selamectin. But there's also the topical product called Revolt is the generic, Revolution is the brand name. And it does intestinal parasite control. It controls heartworm disease, and it controls fleas and ear mites. So it'll do hookworms, roundworms, ear mites, fleas, of course, ticks, which we hardly ever see in cats, and heartworm disease. So it's a really comprehensive product. You put it across the back of the dog's or cat's neck. It comes for both dogs and cats. And monthly you put this on, and this will do all of those parasites. all the control now is prescription. So you have to have your veterinarian write a prescription for you, but this might be a good solution for you if you have cats that are coming in and out of the house and you're concerned that they're bringing in any little creatures, ear mites, fleas, any of those things that your dog might pick up. So it's a really good way to approach that. Now, in the ear canal, we're going to see with an otoscope, with magnification, we're going to see these little white dots. Oh, don't do that. These little white dots that are moving around that you can see through the otoscope. So you see those little white dots. And if you look really closely, you can see them moving. That is an ear mite. And you can only imagine if you had all of those little creatures walking around in your ear, how uncomfortable and itchy you would be. No wonder you're scratching all the time. That is a nasty feel to what's going on. So that's what it looks like with an otoscope. And then the picture on the right is what it looks like under the microscope. So you can see that those are mites, really unpleasant creatures. So no one wants those. And again, this is what the mites look like under the microscope. You can see what we can see is they have little legs and they move and they'll lay eggs down in there and they will set up an entire life cycle. They don't move out to lay eggs. They move around in the ear canal, lay more eggs, and then you have more and more populations of these. So if you wonder why your dog or cat is scratching at their ears, they are miserable because those literally are walking around in the ear canals. Okay. Predisposing conditions. These are anything that sets the ear infection up for an infection. So it's upsetting the microbiome, the normal bacteria, the normal yeast in small numbers that they should have in the ear canal gets upset by grooming. So if hair or water gets down in the ear canal at grooming, that can be a problem. Swimming and humidity can set them up. Hair in the ear canals, we've talked about. Pendulous ears. I love this picture because it shows just how big some of these dogs have ears. And if you've ever held a spaniel's ear in your hand, you will know just how heavy they are compared to a lot of different breeds. Some breeds are specifically going to have ear problems. They tend to have allergies as well. They tend to be the flop-eared dogs. So that's going to be a whole large category of dogs that many of you may have. The doodles, the spaniels, the retrievers. A lot of breeds have these dropped ears, and that just holds in the moisture, holds in the earwax, and sets them up for an ear infection. Allergies like food and pollen allergies are very commonly the underlying cause for problems in the ear. So if you think you're just going to go in and treat for 3 days with an eardrop for an ear infection, you may be sadly mistaken because the dog may have a whole lifetime of skin problems and it will manifest as an ear infection and problems with the feet, but that is not the only symptom. Any dog that's had a previous ear infection may have a narrowed ear canal. Some breeds have narrow ear canals. But if they've had chronic infections, they can the cartilage can stiffen, it can mineralize. The ear canal gets more and more narrow, so it's harder for the wax to get out, harder for moisture to get out, harder for air to get in, and so it just becomes this vicious cycle. We talked about foreign bodies like weed seeds, plant-ons, grass-ons, things like that can get down in the ear canal. Sometimes kids put stuff in the dog's ear, not on purpose, because they didn't really know it was a bad thing to do. But if they put their pencil eraser down in the dog's ear canal, you're gonna have trouble. And of course, inappropriate cleaning and medication. So if you're aggressive on cleaning the ears and you ulcerate the ear surface because you rubbed too hard or you flushed too hard, you can actually make the ear problem worse. So you want to be really careful with that. So all of the above factors will cause a microbiome change, which then changes the amount of moisture and the amount of wax. And so then you develop these chronic recurrent infections. So symptoms of ear infections are going to be that the ear pinna, which is the flap of the ear, whether it sticks up or lays down flat, that's called the pinna. It can be red, it can be inflamed. Some will develop a hematoma, and I'll show you a picture of that in a few minutes. The ear canal will have a discharge, it will have odor. The dog or cat will be shaking their head, scratching, crying in pain. And by the way, itching means that it's a sensation and scratching is the motion you see that goes with itching. So if you're talking to your veterinarian, make sure that you're using terminology that makes sense. We can also see head tilts. This little kitten was in my practice yesterday and he's had this head tilt for a bit. Not unrelated to an ear infection, but nevertheless, he's got a chronic head tilt. So you can see that these are real life things that happen. And then any place you have skin lesions, the feet, the elbows, the belly, the back, any other place that you have skin lesions may also manifest as an ear infection. So if you go in with one problem, you may come out with a grocery bag full of items because there may be a lot of things happening in the dog's overall health. So treatment for ear infections are going to include cleaners used carefully and used appropriately. You want to use very carefully how you clean the ear. and very carefully what products you're using. Things like just dumping alcohol down in the ear, terrible idea. It's irritating, it's painful. If the dog's ear canal or the cat's ear canal is ulcerated, that's painful. You're never going to get close to that cat's ear again if you put alcohol in there. Antifungals are going to be things like ketoconazole and miconazole. Those are frequently found in ear medications. Antibacterials are going to be things like neomycin, Baytril. A lot of different products are used down in ear canals for ear infections. Anti-inflammatories, many ear infections are going to be a combination of an antifungal, an antibacterial, and an anti-inflammatory, because it takes that combination of those three things to get the ear infection and the ear inflammation under control. The anti-inflammatory for the inflammation, the bacterial and the fungal products to get rid of the underlying bacteria and yeast overgrowth. Now, we also see a lot of dogs now being treated with allergy medications. We've always used prednisone, steroids, topical triamcinolone, other steroids topically in the ear canal, but some dogs go on the pills. And then we also have Apoquel and Zenrelia, which are very similar drugs to each other. They both are produced by different manufacturers that will help with allergies. And then Cytopoint is the long-acting injection that's given every 4 to 5 weeks at your veterinary clinic as an allergy medication for controlling the itch and the scratch and all the discomfort that goes with it. Sometimes it requires a diet change, and it may include a veterinary prescription diet. It may include ear cleaners. It may include a laser treatment. And it may end up ultimately, if the worst of the worst of the worst things happen, you may end up having surgery to remove the dog's ear canal, which is pretty advanced and pretty serious stuff. So at the very beginning, if you see that there's debris in the dog's ear, the dog is uncomfortable, you can start off with some really basic, gentle cleaning products. The Zymox products are really gentle, do a really nice job of having an enzyme that helps to break up some of the debris. The hydrocortisone in the red bottle has some anti-inflammatory effects. The blue bottle has a different concentration of it. So you can sometimes get this under control if you early on catch this, you notice that there's odor, the dog is scratching, the dog's ear looks red. If you can very early start cleaning or flushing the ear gently, don't be overly aggressive, and get them started on some medication, you can oftentimes control this. The ear wipes are also really nice for both the feet and the ear canals. We have lots of ear cleaners on the market. We have ear cleaning solutions. Again, this says it's alcohol-free because that's really important to your dog or your cat, that you're not dumping an alcohol-based product down in the ear canal. And then the ear flush can help with yeast and bacterial infections. So it's not just a cleaner, it actually helps to get rid of some of the bacteria that are there. We have other products like Malicetic, which does a really nice job on yeast. Epiotic does a nice job of cleaning up the ear. So there's a lot of products on the market that you can use that are very effective, non-prescription. You should probably have some of these around the house, especially if you have dogs with down ears or flopped ears. And again, you want to be really careful that you don't take a cotton swab. Now, we do carry swabs, but you only want to put the swab in as far as you can see the swab. You don't want to go all the way down into the ear canal, because as far as it takes to get down into the ear canal and to the eardrum, you're not going to hit the eardrum. But what you are likely to do is take wax that's down in the ear canal, debris, hair, all the stuff, and jam it down tighter and tighter and tighter against the eardrum. Therefore, you're setting the dog up for a middle ear infection, potentially an inner ear infection, and it's just going to make the situation worse. So you want to gently flush the ears and help to irrigate that debris out of the ear canal, but you do not want to take a swab and pack that stuff down in there, because it's just going to make the dog or cat more uncomfortable. So the basics on cleaning the ear are going to be applying the cleaning solution. So you just drip it into the ear canal. You don't want to jam the tip of this down in there too far. Then you massage the base of the ear to help move that ear cleaner down into there, let the enzymes that are going to help churn up that wax start working. Then you wipe it out with a cotton ball or with a cotton swab just in a little ways, and then you apply the medication. And if you're only applying the medication once a day, I try to get the ear canal good and dry. Maybe wait an hour if you have time to do that before you put the medication in, because what you don't want to do is put the medication into an ear that's wet and full of fluid, and it's going to just float that medication right out. So I usually will do this outdoors if the weather is nice, because the dogs shake their head and a lot of stuff comes out. If you're doing a cat, of course, you don't want to do it over the kitchen table because you're going to end up with stuff flying on, onto the plates. So be really thoughtful about where you're cleaning these ears, because you'd be surprised how messy this can get. I personally have had a lot of experience with getting really messy. So you want to get these dogs and cats in a place where it's okay to clean, maybe the bathroom, the laundry room, a shower stall, outdoors if the weather's nice. So flush the ear gently, massage the ear, wipe it out, let the ear canal dry, and then apply your medications. So we have 3 different levels of ear infections. Level 1 treatment is going to include seeing a veterinarian, getting a cytology so you know if you're dealing with yeast or bacteria, because you will then change the type of medication that you take home, getting ear drops to take home with you, and then a recheck appointment to make sure that this doesn't turn into a chronic ear infection. So the veterinarian or the veterinary technician will take a swab into the ear just a little ways, take a sample, roll it onto a microscope slide, stain it in the little jars that you can see here, put it under the microscope, and then they will tell you this is yeast, this is bacteria, this is the same thing you had last time, this is different than you had last time, and this is how we're going to treat it, because antifungals don't treat bacteria and antibacterials don't treat fungals. So sometimes we have to be very specific with the medications that we're using. All right, combination products, like I said, are very common. The products that we've seen on the market for many, many years are going to be Tresederm, Animax, and Panalog. Those have been around forever. For more than 50 years, they've been on the market. And like I said, they're a combination of an antifungal, an antibiotic, and an anti-inflammatory, because it really takes the whole tri-pack to get this to work. So nystatin will be an antifungal, neomycin is an antibiotic, triamcinolone is the anti-inflammatory. So you're going to see overlap in some of these medications. Some of the newer ones we have on the market are going to be Baytril Odic, which does a great job on Pseudomonas, but it does not have an antifungal in it. So it's only going to be helpful if you have a Pseudomonas or a bacterial infection. And then we have other products like Positex and Momentomax, which are used either once or twice a day. And again, they're a combination of an antifungal, antibiotic, and anti-inflammatory. So they're great products. They are prescription medications. So you need to get a prescription from your veterinarian. But remember, Revival has a full service pharmacy, so we can ship all these products to you with your veterinarian's prescription. Now, there's a new class of products on the market that have been out for a couple of years. We had a question earlier today about some of these. One is called Ocernia, one is called Claro. For a few years beyond this, some companies were compounding them and having them made specifically for the patient, but these are now commercially available to you. And what's really cool about these products is, unlike anything in your kitchen, like if you have bacon grease or olive oil or Crisco, whatever your fat of choice happens to be, butter, when it's at refrigerated temperatures, it's hard. So like butter on a stick is hard if it's at refrigerator temperature, but at room temperature, it gets soft. Or your bacon grease or whatever, olive oil, whatever, they're all hard at refrigerator temperatures, but soften at room temperature. This is completely the opposite. In the refrigerator, where we store them before we put them in your dog's ear, they are liquid. We take them out of the refrigerator. We pack the ear canals with these products. They're 1 dose in a tube. Pack the ear canal. The dog merrily goes out the door, and the gel will then turn into a gel down in the ear canal. It goes from a liquid at cold temperatures to a gel at body temperature, the opposite of what all the other things in your kitchen do. Gel's in there and then slowly releases the medication, both, all 3, the anti-inflammatory, the antifungal, and the antibiotic, over a long period of time, and then we'll control the dog's ear infection. So if you're struggling with a dog that's difficult to medicate, with an ear infection that doesn't want to go away, if you're just not getting where you want to be, if your dog bites you when you try to put ear meds in, I mean, these can be really painful. So some of these guys need to have this kind of medication. It's a little more expensive. It's typically administered at the veterinary clinic to make sure that the right amount gets down in the ear canal far enough. But these can really be game changers for dogs that are having chronic problems. They are only labeled for use in dogs at this point, but a lot of these medications are too. If you really look, Tresederm and Panalog Animax are the ones that are labeled for dogs and cats. Most of these are labeled for dogs only. And that makes it really frustrating for us when we're trying to treat cats. All right, level 2 treatment. So this is the second time you've had an ear infection, or the ear infection that didn't go away, the ear infection that's really angry. It's one that doesn't respond to medication. You're having to go with ongoing ear cleaning. At this point, your veterinarian may say, this is a pretty nasty infection. Let's do a culture and see what kind of bacteria are there and what antibiotic is going to work on those bacteria. So there's a charge for a culture, which adds a little bit to the cost. But if you can nail down the specific disease that's being treated, you can be more specific and probably in the long run save yourself some money. Now, allergies, these are things that are always going to be there. Food allergies are year round. And pollen and mold allergies tend to be seasonal depending on where you live. I live in Wisconsin. We get cold weather here. Pollens go away in the winter. That's really about the only good thing about winter is we don't have mosquitoes and we don't have pollen. But the rest of the year, we still have molds and pollens that can cause dogs to have allergies. We usually see those spring and fall in our climate, but some climates in the country have it year round. Some climates have none. If you're in a really arid part of the world, like Arizona, Nevada, New Mexico, you may not have any allergies at all because the weather is so dry. So sometimes if we're suspecting a long-standing problem because of a food allergy, your veterinarian is going to talk to you about a food elimination diet where you give no treats, you put the dog on a prescription diet or the cat on a prescription diet that's made for allergies, and we'll show those in a minute. No extra treats, nothing other than water in the food, and that can really significantly help the dog's ear infections. So that can be a really significant game changer as well. Sometimes thyroid disease and other hormonal diseases can cause skin problems and what looks like allergies. And then if the dog is not responding well to treatment or the dog is extremely painful, laser therapy at your veterinary clinic can also be helpful. If these dogs are so painful that we have to sedate them to even get a swab or a culture or to do an ear cleaning, these dogs are really uncomfortable. The cats are really uncomfortable. So sometimes we do have to go to laser therapy to aid with some of the discomfort, and it will improve the speed of healing. Level 3 is going to be surgery. So we'll come back to that. So oral medications, if we do a culture or we do a swab and we see bacteria, we're probably going to reach as a veterinarian for one of the following antibiotics: cephalexin, cefpodoxamine, or clavamox if they're cocci. And if it's rods, we're probably going to reach for enrofloxacin or Baytril. If we see a lot of yeast, we're probably going to reach for ketoconazole. And these are for dogs that either have ear infections that we can't clear up with just ear drops, or that you cannot medicate their ear because they're uncomfortable, they're untouchable, and these guys really need some additional help. So sometimes we have to go to oral medications to get the ear infections under control. Bathing can really be helpful if these dogs are suffering from mold and pollen exposure. So giving a bath and getting rid of the pollens on the coat can really help a lot. And some of these guys will put on steroids like prednisone. We don't want to use any long-acting injectable steroids, but prednisone is frequently used once or twice a week. For these guys that have chronic recurrent ear infections, I'll put them on maybe 1 or 2 pred a week, and that will keep the swelling down, keep the inflammation down, and really make it a lot more comfortable for the dog and more likely that the ear infection will go away. If that's not an option, we can reach for Apoquel, Zenrelia, or Cytopoint. Those are really good allergy medications, but can be a little bit more expensive. So especially depending on the size of the dog, if you have a Great Dane, you're going to probably be in a different situation than if you have a Bichon. So you're going to have to make some of these decisions based on cost, based on availability, based on what your veterinarian is comfortable with. But there are some oral medications that can make a really big difference in these dogs with recurrent or chronic ear infections. Steroids, including topicals, should be avoided if the dog might be pregnant or is known to be pregnant. That means ear drops. So the only ear medication with a steroid in it that you should use if you have bred your female is hydrocortisone. All the other steroids are off limits for pregnant dogs. And because we have a lot of breeders in our group, I want to be really clear about that enough topical steroids, eye drops, ear drops, skin creams, there is enough steroid in some of those products to get absorbed through the skin and cause birth defects in the puppies. So you want to be extremely careful if you are breeding dogs and have ear infections. First of all, you might want to think about not doing the breeding because she's going to hand allergies down genetically to her puppies. And secondly, you cannot use those steroids other than hydrocortisone in pregnant dogs. So Apoquel comes as a tablet, now as a chewable. It's made by Zoetis. It's a pretty great product for dogs with allergies. It's really, the dogs are much more comfortable, but it does get to be expensive. Cytopoint is also a Zoetis product. That's an injectable that's given every 3 to 5 weeks at the veterinary clinic. And then Zenrelia is a new product very similar to Apoquel, but made by a different company, made by Elanco. It does have some limitations on it that are probably coming off the label soon, but right now they cannot be used around the time vaccinations are given. Level 3 treatment, this is when it's catastrophic for the dog, generally not the cat, is a surgical removal of the ear canal. Now, if the dog has a polyp or a growth or a tumor in the ear canal, you can just remove that portion, just the tumor or the polyp. But if the dog has such bad ear infections that you can't do anything with them, you may have to have the dog's ear canal removed. This is expensive. This is a catastrophic kind of thing. The dog ends up deaf, at least in the ear that's had surgery. So we do not want to reach for a surgical procedure unless it's absolutely necessary. So I want to give you all the other options that you have, including the anti-allergy medications to help. So prevention means keeping the ears dry and clean. If you're bathing the dog or the dog is at the groomer, put cotton balls in their ear before they go in. If your dog is swimming, you can use an ear drying agent when they come out of the water or the pond. If they have hair in the ear canal, you can carefully pluck the hair out of the ear canal. There are ear powders that can be really helpful in getting a good grasp of it. I try not to use an instrument because if you inadvertently catch the skin with a hemostat or an instrument, that's going to be very painful and then cause an ulceration in the ear canal, which can make it worse. So I usually just gently pull with my fingers if I need to do that. Nair has been reported. The aloe-based Nair can be used down in the ear canal. Be very careful how you use it, because if you put a big squirt in and then the dog shakes his head and you end up with it flying out and hitting you on the eyebrow, I am not responsible for you having no eyebrow on that side. It'll grow back, but I'm not responsible. You want to prevent any kind of trauma to the ear canal, so be careful when you're cleaning that you don't use something that's too rigid or a swab that's going to cause too much irritation. If the dog has allergies, you want to manage those allergies with appropriate medications, hyposensitization, avoiding the foods that they may be allergic to. And so those are all important things. Now, what happens a lot of times is that people will have the dog on a prescription diet or a particular diet trying to get this ear infection under control, and it may not be working. So sometimes we have to go to something that's prescription. So all of these diets, we have a Royal Canin diet, we have Purina diet, we have Hills diets. These are all diets that have a pre-digested protein or hydrolyzed protein in them. So they are a more expensive diet, but it can be a really useful tool for a 12-week feeding trial to determine if the dog's ear or skin problems get better on that feeding trial. So if you are really stringent and you don't feed anything off the table, you don't give them any of their treats, and you don't give them their rawhide chews and all the other fun stuff that you're used to, you give them their dog food, treats made from the dog food, or treats made for dogs with allergies, and water. If you can do that for 12 weeks and the skin and ear problems clear up, you have a food allergy. Now, if you've done other kind of feeding trials, changing to a lamb-based diet or a venison-based diet or some of those other things, that might fix your problem. But if it doesn't, that doesn't rule out the possibility of a food allergy. So if you're really chronically struggling with some of these things, you want to trot into the veterinary clinic, talk to them about the prescription diets that are options for you. They'll oftentimes have a way to ship to your house so that you don't have to, order it at the vet clinic. You can just order it online and they'll ship it to you. A lot of them have a home shipping diet program. And so these products are available to you, and they can really make a significant difference in the quality of your dog or cat's life if they have allergies. Cats with food allergies tend to scratch themselves so much that it looks like they're trying to scratch their head off. Like, that's a food allergy. If your cat is that itchy and it's not ear mites, you better be looking for food allergies. So there's a lot of aspects to this, and these diets are all hydrolyzed protein, a little expensive because the cost of making the diet is more. But if you feed this for 12 weeks and your dog's ear infection gets better, bingo, you've got a food allergy. Now you can start adding particular items back into the diet to see what you can figure out. Is it beef? Is it chicken? Is it corn? Is it wheat? And none of those ingredients by themselves are bad unless you're allergic to it. I mean, the very best lobster in the world isn't good for you if you're allergic to lobster. So it's not about the quality of the food. It's about the allergens that are in it. If you have a peanut allergy, you can't eat peanuts. I mean, you just have to be honest about those things. The companies also make a hypoallergenic treat. So you can give treats to them, but you cannot give them anything else. I've had lots of people come in. I thought I've gone through them very carefully with what you can feed, what you can't feed. I've had a couple of them come back and say, but he's not any better. I'm like, okay, let's go over this again. What are you feeding? They tell me. What are you giving for treats? They tell me. And what else are you giving? Well, I give him rawhides. Oh no, I gave him a rawhide. It's beef. So very quickly we can figure out some of those things. So be careful about what you're giving for treats and snacks, because you may be undermining inadvertently the situation. Now, a 12-week feeding trial with a prescription diet can be really hard if you've got little kids or elderly people in the house that forget, or a spouse that isn't good at following instructions. So some of these food trials can be a bit of a challenge, but they are well going to pay off if 12 weeks in, you figure out what's going on. So the things dogs are allergic to are typically the proteins and the grains. Again, that doesn't mean they're bad. It just means if you're allergic to it, it's not the right thing. They can be allergic to any kind of dog food, treats, chews, bones. And so you have to go to a hydrolyzed protein or a hypoallergenic diet. Now, the basic premise of ear care, in my mind, is if it ain't broke, don't fix it. So if your dog doesn't have an ear problem, don't start flushing their ears. Don't start pulling hair out of the ears. Don't mess around with the ears if they're not having trouble. Leave them alone. If you start having trouble, then you need to see your veterinarian and talk about what you need to be doing. All right, complicated ears can be things like this. This dog has had chronic ear infections and has polyps and growths in the ear canal and scarring because of chronic ear infections. And this poor little dog, you can see there's almost no ear canal left. They can end up with middle and inner ear infections. The ear canal can mineralize to the point that it's so stiff it doesn't have any flexibility. And sometimes these guys do end up in surgery. If you just have to remove the mass or the polyp, it's not so bad. If you have to go in and take out the whole ear canal, it's devastating. Now, the other thing that we frequently see, not always associated with an ear infection, is an ear hematoma. And that's where blood fills up in the layers between the ear flap and it sticks out from the head because it's like this little balloon of blood. You have 4 options for treatment of those. One is to do nothing, which is probably not recommended. The dog will end up with a lot of scarring, or cat. I've had cats with this as well. Number 2 is to drain it. Number 3 is to drain it and inject it. Sometimes we'll put a drain tube in surgically for 3 weeks and bandage the ear up to the head. And then sometimes we'll go ahead and do a surgical procedure where we make an incision in the ear, drain all the fluid, and then kind of quilt the ear together with buttons to keep the sutures from pulling through. So this is, again, a veterinary procedure, not anything that you would be doing at home, but it does help you to kind of understand the different kind of treatment options, surgically and non-surgically, that your dog may have. If we just put a drain tube in, a lot of those dogs I'll do with doing them awake. If it's a dog that's a little bit more difficult to work with, we'll be anesthetizing them. So that's what we have for today on our ears.
We have got a lot of questions here, so I'll just start from the top and go down the list. So Tanya is saying she's having an unprecedented number of ear infections this year. It looks like she works for a rescue or a shelter. She said both on site and in her foster. She's wondering what may be contributing to such a large number this year in particular.
Well, I'm assuming it's an assortment of breeds. There probably are genetics involved if you have them in a breeding program, but in a rescue situation, it may be environment. It may be that there's too much humidity in the facility if they're all in a kennel. If they're in other people's homes, again, it may be weather related. Allergy seasons can be worse some years than others. The amount of humidity and rain that we get can be worse sometimes. In the wintertime, we don't tend to see as many ear infections when we have snow on the ground in Wisconsin, unless the dog goes out and decides to roll in the snow. So I'd be looking at environment. The other thing that probably can help is probiotics, because probiotics will really help to establish the bacteria that we want them to have in their system. So you might want to look at a probiotic addition to the diet. I'd also be looking at diet. If they're all feeding the same food, or, sometimes it's donated food, so you have to work with what you have, but you may want to look at a diet to see if there's any reflection on that associated with your ear problems.
Okay. Megan is wondering, she works with cats, and she's just wondering, I mean, and you kind of touched on this some cases, but does the information also apply to cats? Can you use a lot of the same products? Just look at the label, whether it's dog or cat, and
Yes.
the processes and all of that is pretty much the same.
Yeah, you can still flush their ears. You can still gently swab their ears. Many of the ear flushes are available for dogs and cats. Like I said, Tresederm and Animax are labeled for cats, but if we get beyond that, and the ear mite medications are always labeled for cats, but if we get beyond that, you might have to decide if it's okay for your veterinary clinic to use those based on what you've got going on. Sometimes we have to use dog meds, even if we prefer not to, because we have nothing else. So you have to speak to your veterinarian about what you can do off label.
Okay. We've got a couple people, Lisa and Judy, are both wondering about the Revolt product, and they're wondering, is that safe to use in breeding animals and during pregnancy?
Yes, it can be used during pregnancy. In fact, it's part of a protocol that can reduce roundworm and hooker migration through the females, the queens and the bitches. So yes, you can absolutely use that during pregnancy.
Okay. Carla's wondering, why are German Shepherds more predisposed to have ear infections than other dogs with stand-up ears? She says her German Shepherd has had 2 within 5 months.
Yeah, it's probably allergies. It is kind of unusual because, like I said, we hardly ever see ear infections in Dobermans, in dogs that have crops, dogs that Sammys, the all the upper the huskies, all the dogs with the upright ears, we just don't see many ear infections in those. It's really unusual. Part of it too is, you can see if there's an ear infection, so you're going to notice it faster because that ear is like up in front of you when you're looking at the dog petting them, and you're going to see that there's redness there. But the dogs with flop ears are almost always the ones that we have trouble with.
Okay. Pamela is wondering, she says, my dog under his ear is brown with yellow bumps on the outside of the ear. Any suggestions what that might be?
Yeah, I'd be looking down in the ear canal because it's probably from that. It could be a hot spot, and the hot spot below the ear is the hardest place to clear up a hot spot. So sometimes you end up shaving the hair off and treating the skin topically, but I'd be looking down in the ear canal because it's probable that he or she is like really uncomfortable and causing self-trauma to that facial structure below the ear.
Okay. Andrew's wondering, is there a way to know if his dog has environmental versus food allergies without having to put them on an elimination type diet?
In my opinion, no. There are some things on the market. You can look online and you'll find a saliva test or a skin test for dogs, and they're not very accurate. The dermatologists that work with a lot of allergic dogs and cats are going to tell you that a skin test where they shave the whole patch of hair off and do little scratches and put little allergens on them, that's really going to be the only way to know which allergens they're allergic to. It really is a food elimination diet. And yes, it's a 12-week commitment, and yes, it's a little bit expensive, but it's really miserable to do without. So sometimes doing that is your best bet. It's only 12 weeks. It's not that long. You just prep yourself. It's like going on a diet. You get rid of all the stuff out of the house that you weren't supposed to eat, like the Oreos and the Snicker bars go away, and you bring in the carrots and the broccoli. So you just have to be thoughtful about what's in the house to feed.
Okay. Kennedy is wondering, how concerned do we need to be with the use of Cytopoint and breeding females?
It is not labeled for use in breeding animals. So number one, it should not be used because we have no safety studies. And number two is, do you really want to breed a dog that needs to be on Cytopoint or other allergy medications? And my answer to that is probably not. In my mind, allergies are sort of level 2 for bad things. Level 1 for me are things that you fix once and it goes away. Level 2 is the chronic things like thyroid and allergies. Level 3 are life-threatening, life-shortening, life-altering diseases. So it's not a level 3, but people don't want to live with allergic dogs. So I would discourage you from breeding allergic dogs because you're going to end up with unhappy people that buy your puppies.
We've got a couple people that kind of asked very similar questions. Just kind of, what is your treatment protocol or thoughts for treating ear infections in a pregnant dog? What do you recommend in that
Yeah.
situation?
We use the ear cleaners, and then we use the products that have hydrocortisone in them because there are several good ones on the market. The Zymox has it. There's a Trizzy DTA that has some hydrocortisone in it. So that can reduce the inflammation in the ear canal, make the female more comfortable. But ear cleaning and some antibiotic topicals without a steroid are probably going to be your best bet. Silver honey is a good product as well. So there's some good ones on the market that you can use, just not anything with triamcinolone or betamethasone or any of those other steroids. Anything that ends in zone is probably a steroid, a cortisone. So avoid those or speak to your veterinary clinic, look up the product label and see what's in it. But if it's a steroid other than hydrocortisone, hands off. No orals, no topicals.
Okay. Jessica's wondering, does Apoquel only resolve environmental allergies, or does that help with food allergies as well?
It helps a little with food allergies, but the pathways are really primarily for the environmental allergies.
Jessica's wondering, if one ear is noticeably dirty from the outside consistently, does this mean it's usually an ear infection, or can a dog just have a dirty ear? They are not itching.
Yeah, it's probably an ear infection. And a lot of dogs with allergies will only have one ear infected. I've had a dog like that, and it's like, I don't understand why one ear is bad and one ear is good, because if it's allergies, that doesn't make any sense. I was actually at a meeting one day with my service dog. I raised service dogs for Canine Companions for Independence, and the speaker walked up the aisle at the break and he stopped at my dog because of course I'm the only one in the room with the dog, and he says, "Allergies?" I go, "Yeah." He goes, "1 ear?" I go, "Yeah." I mean, it was a golden retriever. Like, why does this happen? I don't know. The other thing to be looking at though, if it's on the outside of the ear, and it's typically both ears, and I was going to put this in and then I didn't get back to it, is fly bites on the ears. In the summertime, the upright eared dogs will have them on their ear tips. The flop eared dogs will have them at the base of their ear. And the flies can be really nasty if the dogs are outside a great deal, if they're kenneled outside or they live outside. So we have some products on the market at the Revival catalog that do control the fly bites and the flea and tick preventives that are topical, like Vectra, like Advanix, like Frontline. Those will also help to repel the biting flies and insects. So take a look at that. If you're in an environment where a lot of flies are out, it may be fly bites.
Okay. Somebody's wondering, is it safe to use Zymox otic enzyme? Oh my gosh,
Enzymatic?
enzymatic. I can't talk today suddenly. Solution long term.
Yes.
Okay. Lisa's wondering, I know this is focused on ears, but she has a question related to kind of flea tick treatment, which you kind of just talked about in pregnancy. She said high tick prevalence area is where she lives. What do you recommend as the safest use of flea tick for a pregnant dog?
For topicals, Frontline. For orals, Bravecto. Bravecto is the only one labeled for use in pregnant and breeding animals. And breeding animals means male dogs too. So Credelio, Simparica, and NexGard are not tested. The only one we have testing on is Bravecto. So I would lean heavily on that. That's a Merck product. And if Merck spent the money to do the testing, you should support companies that support you. You're a breeder. You should support the companies that support breeders, because not all of them do.
Okay. Lynn is saying she's been waiting a day to apply any medication after flushing her dog's ears to make sure the ears are completely dry. But is that necessary? Do you wait a day? How long should you wait?
Yeah, an hour or two is probably long enough. I wouldn't put it in right away, but send the dog outside, let him run around for a while, have him come back in, then you can medicate the ear. An hour or two is probably enough.
Okay. Michelle says she volunteers at her local shelter and cleans cat ears after a spay neuter surgery. And she said sometimes there's chunky brown debris in the cat ears. Are those ear mites?
Almost always that's going to be caused by mites. So yes, those little guys should be on ear medication, whether it's Revolution or Revolt, the selamectin product to put over their shoulder blades. So you can do it once. And send it, if it's trap, neuter, and release, you want to do something that's going to have some long-term effects. So you treat them and they go back out. If it's a cat that's going to be in somebody's home, then you can use the ear drops and continue to do that, because that's a better way to treat. Because once a cat's had an ear mite infection, they will always have wax in their ears. They will never completely have a normal ear canal again. So if you can manage them by topical medication, they're going to be a lot happier living in your house. If they're outside, man, that's the best you can do for them. But if they're your house cat, they need eardrops.
Okay. Vicky says her Bichon has her right ear only that has bothered her for the past 6 months. She took her to the vet. They found yeast, treated her twice with lasting ear gel, but the ear still bothers her. She shakes her head and itches about once per day, normally in the evening. The vet says now there is no yeast and the ear canal looks good. Any ideas or any thoughts?
Yes, two thoughts. One is I'd be looking at food as a possible cause, as a trigger. And number two is there are some dogs that just have itchy ears. There are 14 conditions in humans that cause the ears to be itchy with no evidence of an infection. Like your doctor looks in your ear and says your ear is fine, and you're like, no, it's not. So there are some ear drops that just have a steroid in them, like the Zymox has hydrocortisone in it. You can put that in the ear canal safely, and that will reduce the inflammation, and the dog will probably be a lot more comfortable. That poor little Bichon will probably be a lot more comfortable. And there's nothing wrong with using those steroids. You don't need the antibiotic. You don't need the antifungal. If the yeast is gone, you just need the steroid. So get something like the Zymox with the hydrocortisone in it and give that a try. You can do it a couple times a week and see if that controls the problem. And then send us an email and let us know how you did.
Yes. Cynthia says she works in a rescue with several cats that need extremely frequent ear cleaning. She's wondering, is there such a thing as a high producer of earwax in cats, as she's been told, or is high volume dark earwax always an indication of infection?
It's usually an indication of an infection, but like I've said, it's probable that the cat, when it was younger, had ear mites. Even when the mites are gone, those ear canals are never normal. So you will probably always have to use one of the products that have an ear enzyme product, like the Zymox. There's carbamide peroxide on the human side. There's some good products out there that help to enzymatically break up the waxy debris in there and keep them from reaccumulating quite as fast. But those are probably cats that have had ear mites and are just never going to have a normal microbiome in their ear ever again, no matter how hard you try.
Kathleen says, can ear infections cause PSOM, and how to determine if PSOM or just an ear infection if there is a head tilt?
PSOM. I'm not sure what she means by PSOM. Is she still on? Could she send
She
a little
just
more info?
yeah.
Okay.
Kathleen, send a follow-up and we'll go back to yours. What PSOM means.
PSOM. I am not familiar with that particular abbreviation. Um, oh, the other thing about the cats with the chronic problems with their ears would be I'd be looking in those ear canals to see if they have any does she mean Pseudomonas? I bet she means Pseudomonas. Let's do one thing at a time here. Sorry. So the cats that have the chronic ear problems, I'd be looking at those cats for polyps down in their ear canal, that can be viral in origin from herpes or calicivirus. We can see polyps, and that traps all the debris in there, and so they'll have those chronic problems. PSOM, I suspect what she means is Pseudomonas, which is a nasty, nasty infection. Read the question again now that I know what I think she means.
She put primary secretary otis media.
Oh,
PSOM.
okay.
Primary
Okay. Okay.
secretary.
So read me the question.
Okay, hold on. I'm going to scroll up here. Can ear infections cause PSOM, and how to determine if PSOM or just an ear infection if there is a head tilt?
Okay. So yes, that can all be related, and your veterinarian should be able to get down far enough in the ear canal, maybe with sedation, to see what the tympanic membrane looks like. That's the eardrum. If the tympanic membrane is bulging, red, and inflamed, you probably have a middle or medial ear infection. If it's not inflamed, it's probably just an external ear infection. Most dogs with ear infections are external ear canals. They rarely go to the middle and inner ear, but they can. It a little bit is dependent on breed. Again, we get back to the spaniels as having some of the worst problems. So I'm suspicious that she's probably talking about a spaniel.
Shannon says she volunteers for a pug rescue. She's wondering, is Animex something that is recommended for use in the ears with pugs?
Yeah, I think it's a great product. It's a very, very old product. It's been on the market for a million years. It's great stuff. It does almost everything we need ear meds to do, unless they end up with a complicated ear infection. So it's a great product. It's sort of like WD-40. You can put it on almost everything and it helps.
Don't put WD-40 in their ear, though.
No.
Don't
Just
do
stick
that.
to the Panalog. Yeah, stick to the Animax and the Panalog. But I
Right.
mean, you can use it almost anywhere on the body, and it will help as long as the female's not pregnant.
Anthony says he has a female with an ear infection. She is 4 and never had an issue. She has a litter that is a week old. His question is, can he use, like, what would you recommend he use in that situation?
He can use almost any of the ear medications now that the puppies are born, because we don't have to worry about them developing in the uterus. So he can use Animax, he can use Panalog, he can use Trazodone, whatever his veterinarian will prescribe for him is fine. It's safe at this age.
I think, okay, a follow-up. Pamela had asked a question about the bumps that are brown and yellow on the ear earlier. She says their bumps are brown and yellow, are not on the fur, it's on the skin before the canal.
Mm-hmm. So
So,
down, yeah. So I would make sure the hair is as cleared up from that as possible. And sometimes that means shaving the inside of the ear flap if it's a drop-eared dog. So like the spaniels, I will shave the inner part of the ear, the part that touches their face, because the ears are so heavy and that hair is so dense that it cuts down on air circulation. So I do a good shave job around there, and then probably use topical like a silver honey product and see if that can improve the quality of the skin.
okay. Shannon is wondering, at what point are ear infections considered chronic? Is it so many per year, or the severity? When should she be exploring alternative measures such as surgery with her vet? They have not brought it up, but her red bone coonhound mix gets upwards of 3 to 4 infections a year, even with cleaning and flushing.
So unless the dog has to have surgery, I wouldn't do it. More than 3 days is considered chronic. So those are chronic or recurrent. But I'd be looking really hard at allergies on that dog. Even coonhounds get allergies, even though they're tough outdoor dogs, they can get allergies. So I'd be looking at whether this is weather related. Is it worse in the spring and the fall? Is it related to allergies in the food? Are you changing the diet from time to time? And if there's a diet change, does that cause it to flare up or get better? I'd look at a few other things to correlate it. Avoid
Okay.
surgery unless it's an ear polyp. Do not ask for surgery.
Okay. Barbara is wondering what ear mite treatments should not be used for breeding cats. Similar to dogs, probably.
Yeah, the ivermectin product should be fine. The pyrethrin products are probably okay. I just tend to stick to the ivermectin, selamectin, revolution products because I know that those are safe in those applications, as long as and those don't have steroids in them. So those are good for mites. So revolution, selamectin, those types of products.
Lynn is wondering how long is the treatment to kill mites? How long does that take typically?
About 2 weeks, because you have to interrupt the life cycle, because otherwise the eggs hatch and then you have more mites that continue to have a life cycle. So if you're stopping too soon, you're just going to wait for those next hatch to happen, and then you're going to be right back where you were. So I'd treat for 2 to 3 weeks.
Erin says ear checks are not a part of her pre-breeding exam, but she always asks for it. Thoughts? Is that recommended? Do you recommend a ear check?
Yes, because if you do have an infection, it's the time to get it under control is before you breed her. So yes.
Teresa's wondering more about silver honey that you mentioned it. What is silver honey? And can you talk a little bit more about that?
Yeah, silver honey is a combination of silver sulfadiazine, which is a human burn cream. It's labeled for humans for burns, but it's a topical skin cream that clears up a lot of infections, and manuka honey. So again, for open wounds, for chronic infections, for lots and lots of skin and ear problems, it's a wonderful product. It comes as a gel, it comes as a spray. The cream kind of looks gray, which is kind of weird because I'm used to cream looking white. And so when it comes out of the tube gray, you're like, is this okay? Is this like supposed to look like this? But it will heal stuff that, I don't know, it's like magic. It'll heal stuff nothing else heals. So I use a lot of silver honey. It's labeled for dogs, cats, horses. You know, you don't want to lick it, but it's a wonderful product. Ears, it's just a really great product.
Somebody's just wondering now again about flies. You mentioned that flies and
Yes.
ears. Do you have any products you recommend for that? I know we do carry a lot of fly repellents and things like that at Revival. Do you have any that you recommend for repelling flies in the summer?
I like Frontline, Vectra, Advantix. All of those products are going to be fly repellent. So any of the flea and tick repellents, not the orals. The orals don't have a repellency effect, but any of the topical flea and tick products will help, as well as the specific ones for fly bites.
Lisa is wondering, is Millibite Odic a recommended treatment for mites in cats, or should they use a more general flea treatment?
No, that one's fine if that's all you're trying to treat. If you have fleas also, then you'll want to use a product that's going to get more. But if all you have is ear mites, that's fine. But if you have lice, if you have fleas, if you have other stuff, then yes. And so it depends on what you're treating.
Amber says, are you concerned about using Apoquel long term? Her GSD has environmental allergies. Cytopoint worked once, but not as effective the second time. Currently, he's on Atopica by the
Atopica. Yeah,
by the
atopica.
dermatologist for
Yeah.
30 days to clear up a yeast infection. However, she sees the scratching returning, being off Apoquel. She's checked its ears numerous times, and they're not red or infected nor dirty.
Mhm.
So
So Apoquel looks like it's safe long term. There's some rumblings here and there about things, but I've never seen a study that indicates that it causes any long term harm. Zenrelia is another option for you that some patients will respond to if Apoquel does not. It's in a similar drug class. It's in one of the JAK drug classes that interferes with a JAK pathway for inflammation. But if Apoquel is working, stick with Apoquel. Atopica is an older product. It's cyclosporin, and it's been on the market for a long time. But you know, different patients respond to different things. If you have allergies and you go to the allergist or the pharmacist, they're going to say, well, here, try 6 different antihistamines, and the one that works best and doesn't make you drowsy is the one you should take. Well, it's kind of the same with dogs, is we don't know which dog is going to respond to which medication. Some dogs on Cytopoint do better. Some dogs on Apoquel do better. Some are Atopica. Some nothing works for them. We have to reach for prednisone. So it depends on the patient. We are all our own little chemistry labs, and I don't have a test that predicts which chemistry lab you are. and what you're going to respond to or what your dog's going to respond to. So we have to just do it by trial and error.
We do want to mention Dr. Greer is an author, as many of you know. She's written these 2 books, Your Pandemic Puppy and the Canine Reproduction and Neonatology books. So make sure to check those out. Again, full of knowledge on all subjects, right? Not just ears. Again, as I mentioned earlier, if you do have additional questions, need help ordering, need help finding the right ear care products for you, whether you're a breeder, whether you're a shelter, whether you're a pet owner, call our animal care specialists at 800-786-4751, and they are happy to help. We encourage you to sign up for Revival text messages. This webinar, along with a lot of our resources, we do send out via text. So if you want to rewatch it again, this is a great way so you don't miss it when it comes out. You'll also get coupon codes and other money-saving offers, pet health resources, all sorts of things like that. So I encourage you, if you don't already, to sign up for text messages. Either scan that QR code or text Revival to 23551. And then you'll get your text messages right here on your phone. And it's so handy. Thank you again, everybody, for joining us today. Such great information. I think a lot of people got a lot of great resources and information and ways to go forward now and learn about more ear health. So thank you, Dr. Greer, for joining us today. And everybody have a great rest of your day.
Thank you.
Thanks for watching. Make sure to subscribe to our channel so you're up to date with all of our latest videos. If you have an animal health question, be sure to give us a call at the number below and check out our other animal health videos.